Hi, and thanks for joining us. You may have been prescribed pegcetacoplan, a subcutaneous infusion you administer yourself. This means a needle is placed under the skin and the drug is slowly infused. Whether this is your first time giving yourself an infusion or you're here for a refresher, I'll show you step-by-step how to administer pegcetacoplan. Once you've learned the basics, it can become just another part of your routine. A doctor or a qualified healthcare professional should show you or your caregiver how to infuse pegcetacoplan the right way before you use it for the first time. Ask your healthcare professional about any instructions you do not understand. And if you have any questions or concerns during your treatment, don't hesitate to call your healthcare team. Pegcetacoplan must be stored in the refrigerator. It may come in a box that contains 8 single vial cartons. Before use, remove a single carton from the box in your refrigerator. The carton contains 1 vial of medication. Leave the medication inside the single vial carton. Keep the vial at room temperature for about 30 minutes. Never try to speed up the warming process in any way or return the vial to the refrigerator after warming. Step 1. Getting ready. While the vial is warming to room temperature, gather your infusion supplies. You'll want to choose a space with a flat work surface in an area that is well lit, safe, and clean. It is recommended that your space be away from children and pets. You'll need the pegcetacoplan vial, syringe system infusion pump and manufacturer's instructions, compatible syringe, transfer needle or needleless transfer device to draw up product from the vial, the infusion set, which varies according to device manufacturer instructions, infusion tubing and Y connector, if required, sharps container, alcohol wipes, gauze and tape or transparent dressing. Always thoroughly clean the table or flat surface with an alcohol wipe. Wash your hands with soap and water and then dry them. Step 2. Checking the vial and liquid. Once the vial reaches room temperature, which should take about 30 minutes after removing the carton from the refrigerator, you can remove the vial from the carton. Pegcetacoplan is a clear, colorless to slightly yellowish liquid. If the liquid in your vial looks cloudy, contains particles, or is dark yellow, don't use it. You should also not use any vial with a missing or damaged purple flip cap, or if the expiration date is passed. If the vial is unusable, throw it away and remove a new vial from the refrigerator. You must wait about 30 minutes for the vial to warm up before repeating step 2. Step 3. Preparing and filling the syringe. Remove the protective purple flip cap from the vial. The central portion of the gray rubber stopper should be exposed. You can throw the purple cap away. Use a new alcohol wipe to clean the stopper, and then let the stopper dry. Attach a sterile transfer needle to a sterile syringe. Pull back the plunger to fill the syringe with air, which should be about 20 milliliters. This air will make it easier for you to withdraw the medicine from the vial into the syringe. Push the air-filled syringe with the transfer needle attached through the center of the vial stopper. To avoid creating bubbles, the tip of the transfer needle should not be in the solution. Gently push the air from the syringe into the vial. Turn the vial upside down and move the transfer needle tip into the solution. Slowly pull the plunger to fill the syringe with all of the pegcetacoplan liquid. Remove the filled syringe and the transfer needle from the vial. Do not recap the transfer needle. Unscrew the needle and throw it away in the sharps container. Step 4. Preparing the syringe system infusion pump and tubing. To prepare the syringe system infusion pump and tubing, follow the manufacturer's instructions that come with your device. Step 5. Preparing the infusion sites. Pegcetacoplan can be infused in the abdomen, thighs, hips, or the upper arm regions. Use different sites from the last time you infused pegcetacoplan. If you are infusing in more than one site, select infusion sites that are at least 3 inches apart from each other. It's important to rotate your infusion sites between each administration, and do not infuse into areas where the skin is tender, bruised, red, or hard. You should avoid infusing into scars or stretch marks and avoid areas along your belt line. Clean the skin at each infusion site by rubbing a new alcohol wipe on your skin, starting at the center of the site and working outward in a circular motion. Then, let your skin dry. Step 6. Inserting the infusion needles. Pinch the skin where you intend to place the needle between your thumb and forefinger. Insert the needle into the skin. Angle the needle according to the instructions that came with your device. Next, apply sterile gauze and tape or transparent dressing over the infusion site. This will hold the needle in place. If required, repeat this process to prepare a second infusion site at least 3 inches apart from the first infusion site. Step 7. Starting the infusion. Now you're ready to start the infusion. Follow the instructions that came with your device to start and to complete your infusion. You should start the infusion promptly after drawing pegcetacoplan into the syringe. Step 8. Completing the infusion. Follow the manufacturer's instructions that came with your device to complete the infusion. Step 9. Recording the infusion. When you finish the infusion, record your treatment as directed by your healthcare professional. Step 10. Cleaning up. After the infusion is complete, remove the dressing and slowly remove the needles. Cover the infusion site with a new dressing. Disconnect the infusion set from the pump and discard into the sharps container. Throw away all used disposable supplies, any unused product, and the empty vial as recommended by your healthcare professional. Follow the manufacturer's instructions to clean and store the syringe system infusion pump. Remember, you should always talk to your healthcare team if you have any questions or concerns about your treatment.